Okay, good morning. Can you hear me at the back? Yes. So there, you guys are getting less and less. I don't know, is that a phenomenon? How many are you supposed to be? Definitely the boys were more last time. Is there like a set number or just a total number?
Around 30 students are supposed to come.
So these are not 30.
But I think so. There were there were 2 students who turned out COVID positive, and I think their friends were also asked not to come in.
Oh, I see. And everybody else is fine?
Hopefully.
All right, thanks. All right, so last time we stopped at Winnicott. So you guys were at home, right? Last time, okay. So Winnicott is one of these people who talks about how, people relate to each other, all right? Girls in the very right. Are you okay? Do you have a conversation you want to finish? Okay. So Winnicott discusses like certain, let's say, theories, okay? The beauty of Winnicott is when you understand that it can apply to how we can do some interventions today, right? So when we do psychiatry, we study a lot of theories. And the reason being is when you meet a person, a client, with whatever issues they have, you can implement different theories that you've learned in practice based on whatever this patient is presenting with. Now, there are some psychiatrists who are like psychoanalysts, and we'll talk about Freud later on. And so they practice that kind of therapy regardless of what the problem is. So they are Freudian, okay, or they are, let's say, object relations, which we'll be talking about as well. But nowadays, again, therapy in the past, where you get into therapy and it could be forever, if you're doing psychoanalysis, and so it's the model being you're on a couch and the therapist is kind of in the background, and it's a lot of ahas, tell me more, kind of, not so much of interactive sort of treatment. And so that kind of treatment can be endless. There's no end point, okay? So you see your psychiatrist every week or maybe 3 or 4 times a week indefinitely working on, usually it's issues related to, your childhood or your kind of upbringing and its impact on you, okay? Now that kind of therapy, like nowadays, most people want a quicker result, right? You don't want to get into something that's going to take you 20 years to figure out, correct? Or are you willing to be there for, you're now 20 something years, or maybe you're like 19, I don't know how old you guys are, but you don't want to spend the rest, equal amount of years trying to figure out what the problem is. So most people now want something that is like more like time limited and that they can understand the outcome. So a lot of therapists now do what we call cognitive behavioral therapy, which I don't know if you've heard about, but it's very focused on symptoms. So you're anxious or you have interpersonal issues, and so you go in for that specific reason and you work on it for, let's say, 12, 20 sessions, and you kind of get a sense of where the issue is, and life goes on. So we learn about a lot of theories and people who wrote these theories, and we implement now based on the problem. Okay, so I like Winnicott. It just appeals to me because of what he describes. Okay, so he talks about 4 main sort of concepts, right? So he says that the mother, okay, so for each of you, your mom is the best mom, right? Yeah. So we all think our mother is the best. What makes your mom better than her mom? What do you think?
Just related.
She's what?
Related, that's why.
Because she's related to you, okay? Doesn't make her better. But does that mean that you're amazing and so therefore, so because you're amazing, therefore she must be amazing?
No, that's what I mean.
For you.
For each other.
Yeah, so she is amazing to you. She may not be amazing to your brother or your sister, right? She may not be the best mom to them because it depends on the experience that you've had with your mom, okay? So the good enough mom does what? What do you think an amazing mom does?
That she's present.
So she's present, okay?
She cares.
There's care.
Communicate.
She communicates. Is she someone who's judgmental?
No.
Is she harsh? Like the good, that amazing mom. So she's the person that if you fall, she's going to be the one to kind of wrap you up and make you feel like you're safe and make you feel like you are the most important person on earth. Okay. So it's really important for kids when the mom looks at them, that they feel like they're the apple of her eye. Have you heard? Do you know what that means? What is the apple of her eye?
The whole world is a world of.
Yeah. So the whole world revolves around you as a kid. Okay. Now that is a great sense, or it's a great feeling to transmit. However, it's not something that you want all the time, because otherwise you become somebody who's so egocentric, right? If the whole world revolves around you all the time, then that's not a healthy kind of a relationship. So as much as you want mothers to be, you know, that loving and caring and non-judgmental, and you're the apple of their eye, but also you want moms who can sort of give you a bit of highlight on, you know what, that wasn't right. No, you shouldn't have done that. Versus, oh, you're the most amazing. Oh, you can do whatever. Oh, you can walk all over people. So, you know what I mean? So there's that balance between being that good enough mom versus a mom that just feeds narcissism into her child, okay? So he talks about the good enough mothering, and he relates that to the therapeutic environment. So a therapeutic environment is one where you, the therapist, okay, again, it's very relative, become that good enough mom. So you, the therapist, to your client, become that person who is accepting, non-judgmental, supportive, and caring, you know, and you can imagine that's an environment where people are going to flourish, right? So this is an environment where it's a healthy one, so you're going to grow, okay? So in that kind of environment, okay, every one of us has two parts of ourselves, okay? So you have a true self and you have a false self. Does that make sense? Okay, so your true self is something that you would feel is the real you. Have you been around people where you feel like, when I'm around these people, I just feel like I'm myself. I can just, you know, kick back, I can do whatever. They're not going to judge me. But when I'm around these kind of people, I feel like uptight, I feel nervous, I feel I have to put on this like face because I'm going to be judged based on what I say or what I do. Have you had that experience? Okay. So it's something that we have, and it kind of fluctuates based on situation. But would you want to be in a situation where your true self just never shows? Do you think that that's healthy? So a good enough mom in a holding environment really allows the true self of her child to kind of, let's say, shine, okay? Because she's not judgmental, she's not critical. So whatever this kid is, you know, he's clumsy, he's unsteady, for whatever reason, you know, she still thinks he's the apple of her eye, okay? So there's no need for this kid to kind of put on this facade or like a face to pretend, because he feels safe enough to just be himself, okay? So those are qualities, again, of that amazing place or space where you will absolutely flourish, okay? And again, it can spill over into the therapeutic environment, where if you are that kind of a therapist where you are accepting, non-judgmental, you're gonna see the true, let's say, face of your client. They're gonna feel comfortable enough to show you who they really are without feeling shame or guilt or embarrassment that you're judging them, okay? So that becomes your role, is to allow that space. Again, it's very it's not a concrete thing. It's not like I'm going to sit there and I'm going to be the best therapist on earth. It doesn't. It's not like that. It's very interpersonal. It's how you feel and how the patient feels, and so it's sort of like a dance. Okay. Now, a transitional object is something that a lot of kids, I don't know if you yourselves as children had or not, but have you seen kids walk around with a blanket, or they hold on to a toy when they're going outside of their house? Have you ever seen that? Okay, so have you ever seen the cartoon Snoopy? So there's a character called Lionel who's always walking around with a blanket. Okay, so we call those things transitional objects, and what it is, it's something that kids take from the holding environment, that safe place, and it becomes a part of, like, that's my mom, that's my safety, and then that's how they can get out of the house or go to the world, if you will, because they have that transitional object with them.
Sometimes why they do that where their mom is beside them?
It's very symbolic. It just means it's a comforting, it's a comforting object. It's very symbolic of her. It does not replace her. It doesn't mean that, if she's there, then that they must have it. A lot of times, even if she's there, it's not necessary. But for some kids, it then becomes like a habit. It's like a stimulating, like a texture. Okay, but we've seen kids, for example, when they're going off to nursery, they'll take their toy with them because that's symbolic of home, and so they'll go to nursery and they don't want to let go of this toy because they feel like, I'm taking home with me to nursery. And so it becomes a bit of a struggle, and let me take your toy home. So a lot of times we just allow it because initially, until they feel safe enough, then they won't really need that transitional object with them. I remember a mom who had a kid just had a lot of difficulty sleeping, okay? But he would sleep with, she had like these silk scarves, and so he would, touch the scarf. It had her smell. But she didn't realize the value of it until she washed it. So he would really calm and be soothed when she just give him her scarf, and then when she washed it, he no longer responded to it. Okay, so it wasn't really the scarf as much; it was her smell, right? So I think she went and bought like 100 of those, all had her smell, and so she wouldn't really she would then replace and wash. But the idea being, it's her smell. Okay, so her smell. Her like aura is what helped him stay comfortable. So in a therapeutic environment, so the transitional object would be what? What do you think? What is the link between like the patient or client and their therapist that's transitional? Obviously, I'm not going to give my patient my scarf or anything that belongs to me. So what could be a transitional object that could soothe the patient in between sessions until I see, the therapist sees them again? What do you think? So something of you, but not really something that you actually...
The advice that you give them?
It could be more concrete than that, like something more material. So when I was doing my residency, we had offices and we had phones, and so back in the days, so you leave your like an answering machine, so your voice on the answering machine, right? So my patient, my client would say, you know what, in between sessions, because it was weekly, if I stressed out, I would just call and I would hear your voice. Okay, so she would hear my voice just answering, hello, this is Dr. Irfan, please leave a message. That was it. So just hearing that was calming enough for her. So that was her transitional object. For some others, it could be your card. So you give your patient your business card. So that's the transitional object for them. It's something that belongs to you, that they feel, safe. So I'm now seeing, I'm like doing like a Zoom session with this 16-year-old in Khobar, okay? So she has, issues in relationships. And so what she's been doing lately is, she'll text me on Thursday, Friday, confirming, are we having a session on Sunday? Okay, so it's more like, so that is really her transitional, it keeps her kind of waiting until every Sunday when, I see her and we have our session. So the reason I like Winnicott is it makes a lot of sense in actual therapeutic environment, because then you become that person who is accommodating to your client. But again, it's really important to make sure that you don't cross boundaries. So our clients are not our friends. Okay, we are not going to go out and socialize with them as much as they do want to. Like they feel like they're really attached to you and they want to be your friend and they want to invite you and all of that. But we have to have like very clear, very clear boundaries that, I'm here to help you. I'm not your friend. And that just saying can sometimes be hurtful to some, because they feel like, I'm so attached to you. Why don't you want to be my friend? So what would be an answer? Why don't you want to be my friend? Especially if you're close in age. Why do you think it's not a good idea to be friends with your clients?
Be biased.
There's bias. Okay. Why would you be biased?
You want the rational.
So you're not really going to be helpful to them. Okay.
Maybe because as a therapist, you don't want to be like affected by others' harm. You just want to help them. And being their friend could affect you.
Yeah.
Maybe make you sad or have bad feelings.
Maybe they're gonna get too dependent.
So they get to depend, but I mean, the beginning part of it is ethically, you can't. So there's an ethical, problem with that. No, you cannot be friends with your patients. You cannot marry your patients. Especially with therapy. I mean, we do hear of doctors who marry patients, but again, it depends on the relationship. If it's somebody that you saw in consultation like once or something, again, there's a lot to be discussed in that area. But for sure, as a therapist, because your patient is most vulnerable when they are with you, you know everything about them. Okay, so it's really important to have very clear boundaries, because you don't want that to be. It could be very easily abusive to them. You can take advantage of people. Just because you know all their issues, So we have to be very careful. As much as, sometimes we get into therapy with, people who are very similar in age or similar backgrounds, and you feel, oh my God, yeah, we could be really good friends, but, it's not ethical. So I remember in the Royal College exam, one of the multiple choice questions that we had was, this is a female therapist and she has a male client, all right? And then she notices that as sessions progressed, she started to pay more attention to how she looked and what she was wearing the day that she had a session with this client, okay? So she started to kind of feel more interested in herself and how she looked whenever she had a session with him, okay? So the multiple choice question, the options were, so should she continue in this kind of a relationship? Should she just refer him to someone else because she's becoming emotionally attached to him? Should she discuss this with her peers? What do you think she should do? So she should discuss it with her peers, okay? Because some people, some would say, the wrong option obviously would be to end therapy. And why would that not be a good idea?
Traumatic to them, and all of a sudden you just stop them.
Yeah, because it's not really his fault. He didn't do anything. He just comes to therapy. So it's not his issue, okay? It's her issue. So discussing it with peers is really essential, because they kind of can highlight what is going on in this relationship with this client and why is she developing such feelings. Also, sometimes we notice in therapeutic sessions, some therapists would avoid discussing certain things. Like, for example, I had a friend of mine who just felt really uncomfortable to discuss death. Whenever her clients would have issues around death, dying, she found herself kind of closing up the topic and moving on to something quickly. So she just noticed that, why am I doing that? Okay. And so we discussed that. So she'll say, I just feel like, every time someone talks about death, I'm really uncomfortable. I don't feel like I want to discuss it. How is that negative for the patient?
They're gonna feel like they're not comfortable.
Okay, they may not feel anything, because we don't say, it's not that abrupt. It's not like you're talking about death. I'm like, oh, okay, let's talk about something. It's not that sudden. So patients will not feel that you're shifting. You feel that you're avoiding. certain things. They don't really feel it. So why is that like negatively impacting patients when you are avoiding certain things that they are talking about?
Because they didn't give the enough information about the whole.
Not about information.
Might be related to their condition.
Sorry?
Maybe related to their condition.
You're not going to give them the space that they need. Again, think about the holding environment, the good enough mother who will listen to you regardless of what it is that you have to say. So you're not actually being that. So maybe this patient has issues around death and dying, and you're not allowing them the space to actually talk about this issue and deal with it. You are closing it up, you are avoiding it because it's uncomfortable to you. So it's really important for anyone who wants to get into mental health in general is to have that sense of insight. Again, we're not always insightful, but it's to have some insight and be open to like peer discussion about like why we do certain things. And we'll talk about that in other lectures. You know, why do people do what they do? Okay, why? And that's really trying to understand who you are as a person and why you do what you do. Okay, so that is Winnicott. Any questions?
I'm just, the issue is from the patient, like she's trying to get close to me. How do I stop that?
Well, that's a really good question, because it's, let's say you notice a patient, it could be and not only in mental health. I mean, you could be the pediatrician, and you know this mom is trying her best to be your best friend. Okay, so the advice that we give is, if you notice something, like it's like a bulb turns on. Okay, you notice a pattern. Okay, we don't address things from the first time it happens, because it could be just a pure coincidence. So we let things, like, you know, if you notice it's a trend, okay, this person's repeatedly trying to invite you, she's wants you to come to birthdays, and so we usually say things like, I really noticed that you're really trying to involve me in, you know, a lot of social activities in your life, and I really appreciate that. However, I cannot do that because that's not the type of relationship that we have. I'm here, I am your, you know, daughter's physician, and this is how it's going to be, so that I could better help her. Okay, so
It was from the patient herself, like the daughter. She's getting attached to, like, cannot hear this from you telling her, and I don't want to.
you mean the patient is a child?
Or even an adult.
Okay.
Yeah, I've seen this, I've heard about this, you know, the patient gets really attached to the
Therapist? That happens a lot. Okay, so it's something that we're again talk about later. It's called transference and countertransference. So it's how this patient gets attached to you. All right, and again, as a therapist, you have to be aware of this happening. Okay, and you have to address it, because it could be that part of this person's problem is the way that they attach to others. Okay, because the way that they're attaching to you, again, the therapeutic room is like a micro of the world. So how they deal with you is pretty much how they deal with the outside world. And so it's kind of, but then it's all obviously magnified. So you could then just sort of say, I just noticed that, you know, you try so hard to kind of let me be involved in whatever. Or I kind of noticed that you're, you know, the way that you are dealing with me is whatever. Tell me more about that, because they may not actually be aware of it at all. Okay, so one of the things is you want to like discuss it, but not say, hey, you're becoming too attached to me. That's not okay. It's not ethical. No, we don't do that. But we notice, we throw out these kind of comments of, I noticed this. Tell me more about that. How do you feel? All right. And then it just opens up a whole bag of so much stuff that they could be telling you, yes, I feel like I'm safe when I'm with you. And then, well, you know, then you can get into all sorts of like, say, like, why do you not feel safe here or there? So there's a lot to learn by these open-ended. And for psychiatry, we love open-ended. It's just like, we love open-ended, tell me more, and turning things around so that it's more about you and not me, okay? All right. So again, this is the last slide of last week's lecture. So the need to assess the social network for people. And we're talking about kids in specific. So the social network of children. Yesterday, one of the residents was asking me about a 3-year-old she's the only child of two physicians. They're not Saudi. I think they are either Indian or, and so they live here, so there's no family. So the gist of it is they are not with their family. They are physicians, so therefore working hours are long. And so they noticed that this girl is kind of regressing. She's not picking up on language. So could this girl be autistic? Okay. So then we talk about what is this child's social network? Who else is in this child's life? So if she only has these two parents, there's no family, like there's no grandmother, no aunt, okay? She's still not in school. And even if she were in school with COVID now, people are at home. So would that affect the social development of a child? Okay, what aspect of it?
Linguistic.
Hmm?
Linguistic.
The linguistic, okay. So the language is I would agree, but sometimes kids have language, but they don't know how to communicate it. So she may know words, but she doesn't know how to use it in context, and she doesn't know how to really relate to others. So the language part, the social part, the emotional part, and emotional regulation, okay, because there's no, so what does a child need in order to practice everything that they've learned at that age? What do they need?
People around them.
People as in like people, or as in people? So they need kids, because when she said that, I asked the first question, is this an only child? Okay, because it makes a big difference if it's an only child versus one of 3 or 4 or 5. It's almost like a mini, nursery at home with 4 or 5 children. There's practice, because we'll learn now in this lecture that we're going to talk about. There's so much that kids learn from each other that they'll never learn from adults. Okay, it's like you're talking completely different languages. Okay. Again, the social network can be based on culture. What does that mean?
Some cultures have larger families.
But a family, whether it's large or small, is not based on your culture. You either have a large family or you have a small family. So even if you have a large family, depending on your culture, you can either mix with them or not mix with them. Okay. So we had a patient who's socially anxious. Okay. So she's socially anxious and kind of doesn't want to go to school in the days when people went to school. Okay. And so one of the things I was recommending to the mother, and again, that was, maybe not very tactful of me. I said, why don't you arrange play dates so that she can see the girls from her class? And she's like, we don't see anyone outside of school. It's not in our culture to visit anyone. So that's within their culture. So that means you have to give them advice that works for them. You can't give people advice that works in Scandinavia when they live in Batha. You know what I mean? It doesn't work. So you have to assess what is their culture, what is permissible, what can they do or can they not do. Now, when you're dealing with anxious children, if you live in a kind of a cultural network that's really limited, where you're only going to see your cousins, nobody else, and it's only going to be the girls and not the boys, as you get older, does that foster anxiety if you're an anxious child, or does it help it? Thing is, anxious kids need to be exposed to new situations all the time. So they need to be out and mixing with new people, different people. So seeing the same 2 cousins every week for the rest of your life is not going to help you if you're anxious. It doesn't work.
Is it like the black children, when they saw the white kids, they can see something strange?
It's something strange, but also not about the color as much as people. If you're only going to see the same 2 or 3 people, and you're an anxious person, you're going to feel very comfortable. Like anxious people, I want to tell you, with COVID and lockdown and online, some kids are having a blast. Okay, what kids are having a blast? Anxious kids who are always bullied. Okay, so these kids, this is like, and obviously anxious kids want to be next to who? Sit next to who all the time? Mom, right? So mom's right there. Mom is there, school is there, nobody's bothering them. Do you think these kids will ever want to go back to school? Definitely not. Okay, so this is something we worry about, honestly, when we're thinking about how things are going to be if we ever go back to normal, is these kids, because now there's absolutely no exposure. Plus, they're not even seeing the 2 cousins that they know forever. Like, they're not even seeing those. So, so this kind of culture doesn't help kids who are really anxious, okay? So childcare again reflects the values of a particular culture, but this may change with change in values. Again, we've seen over time, if you compare how things were when your grandparents were raising your parents versus how your parents were raising you versus how you are going to raise your children, can you see a change? Okay. Does it mean that there's a change in values? Are your values different from your grandmother? Basic values would probably be similar, you know, that's your basic kind of value. Again, even those may be different. It's so variable. Okay, your values may be the same as your grandma, but your sister's values may be completely different. Okay, even though you have the same parents. So values are going to change based on so many things. And again, social media and its impact is unreal, really, when it comes to kids these days. So I don't know about when it's you guys having your own children. I don't know what that's going to be like. I'm telling you now, it's just not a happy scene. Okay, because we're seeing that. Yeah, I'm seeing this girl in therapy as well, who developed OCD. Okay, post exposure. So she was with her friend and they were checking out something called Discord. Is there such a thing? Okay, so kids, she's 12 years old, right? So there's this new thing or app or something called Discord. And so through this, they chat with people, okay? And so apparently these older men were like hunting for these younger girls, and they found her and her friend. And unfortunately, they showed these young girls things that are way beyond what they should have seen. And so she kind of had a nervous, you can say it, nervous breakdown. Like she was completely fell apart. And then she started to develop OCD. So now all the time if she ever like watches something or reads something that may have any inappropriate content, she gets really anxious. Okay. So now we're treating OCD secondary to exposure to something that was really unfortunate. So I'm saying like you're sitting in your own, and this was during lockdown, okay? So you're sitting at home completely safe, and then, you know, things can reach you, okay? All right, so we're gonna move on. So this is part 2, okay?